Okay, I've gotten some positive feedback about these tutorials for each module, so I think I'm going to go ahead and continue to make a brief tutorial for each of these modules just to make sure that there's clear communication with all of you. So here we are at week 3, module 3. We're getting there. Remember, after you complete this week, you're halfway there to the finish line. So keep your eye on the prize and keep up the great work. So the topics for this week in this module are going to be communication and the therapeutic relationship, the psychiatric nursing process, psychopharmacology, dietary supplements and biologic intervention, cognitive interventions, and group interventions. Oh, in addition to family assessment and interventions also. This module corresponds with chapters 9, 10, 11, 12, 13, and 14 in your book. There are 3 assignments that are due for this module. So again, let me just click on module 3 here. And again, you're going to see all the supplemental material that goes along with your textbook for the corresponding chapters in this module, the guided lecture notes and the PowerPoints. Again, feel free to look at it if it's helpful to you. If not, you don't need to. Let's click on Module 3 assignments. So there are again 3 assignments for Module 3. Let's take a look at each one of these in detail. So Module 3 Assignment 1 is a process recording with analysis. I had not done a process recording for quite some time, and when I was developing this course, it's an oldie, but it's a goodie that I dug out from uh, millennia ago. So bear with me here. Let's click on that to find out a little bit more information. So this is actually one of 2 assignment submissions that you're going to be completing for this module. And I have a guide to process recording here. It's a PDF document. And I think it might help to actually just walk you through it. So a process recording is basically a record of a discussion with a person entrusted to your care for the purpose of this assignment. Whether or not you work in a psychiatric mental health setting, it really doesn't matter because you know and I know that mental health issues come up whether you practice in critical care, whether you practice in corrections, whether you practice in any environment. It's going to be part of your day-to-day practice life. So the objectives really are to get to know yourself better, and it is a process really that allows you a deeper self-reflection into why you say the things that you say, why you respond the way that you respond, and gives you kind of clues to your pattern of both verbal and nonverbal communication. So the objectives are to develop a conscious awareness of therapeutic communication methods used to help an individual suffering from mental illness, to accurately chart the interaction to the best of your memory, to identify the congruency between verbal and nonverbal communication, to analyze the significance of the communication, to identify your own feelings in relation to the interaction, and identify themes that the client has expressed. So really, this is about getting to know yourself a bit better in order to reflect and then improve your own practice. So the successful student will try to spend at least 30 minutes with one client during a clinical day. That certainly is going to need to be flexible. I know that some of these interactions take place in 2 minutes to 3 minutes period of time. This is just an ideal situation, so don't get caught up in that number. And then you will record as much of your interaction with your client from memory as possible. Now, this again says 10 minutes. That would be a perfect situation, but chances are you're going to be looking for about 2 to 3 minutes. It may occur in that short a period of time. You're going to include verbal and nonverbal communication of both you, the nurse, and your client. You will describe your thoughts and feelings about the interaction. And the following questions, A through F, can be used to kind of guide this part of the assignment. They're not mandatory, it's just a guide. The third part of this assignment is really the analysis. So the evaluation of nonverbal communication on both your and your client's behalf, labeling each of your responses according to the various communication techniques used, and you can certainly use chapter 9 in your textbook for those examples. Label each nurse response T for therapeutic or U for untherapeutic when you're reflecting on your part of the communication. Suggest alternative interactions, both verbal and nonverbal, which might have enhanced the interaction, and then identify a theme or themes of concern on the client's behalf during that interaction. And then this says, please feel free to use the example on this page as a template that can really help you. So you can do this in whatever format you would like to use. As long as you can upload it as a Word document, you feel free to make sense of this in whatever way that you will. But this is a great sample template to follow. So the first column is all about you, your verbal and nonverbal interaction with the client. The second column here is a recording of the patient's verbal and nonverbal interaction. The third column is your own thoughts and feelings about the interaction, and feel free to dig a little deeper here. This is probably the most important part of this assignment, and that'll be reflected in the grading rubric, which I'll show you next. Don't just dwell on the surface. Feel free to explore a little bit more deeply than maybe what you're used to. The last column here is the analysis of the interaction. So taking a look at things and saying, hey, I did a great job. This was therapeutic interaction and nursing process with this client, or maybe something was non-therapeutic or untherapeutic, and what could I have done better? What could I do better the next time? So we can also view the grading rubric here. Okay, so you will see that recording of your verbal and nonverbal communication is worth a total of 5 points. A record of the patient's verbal and nonverbal communication, again, worth 5 points. Recording your thoughts and feelings about the interaction. I lied. This is worth 5 points. Analysis of the interaction as therapeutic or untherapeutic with reflection on what could be done differently to improve. That is worth a total of 10 points. So this assignment is worth a total of 25 points, with most being labeled here in this last column. Okay, so let's exit out of that and let's go back to these assignments. Okay, let's take a look at the second assignment, Module 3, Assignment 2. This is another assignment submission. And the instructions here are pretty short, sweet, and to the point. Please turn in your textbook to page 126, box 10.1, labeled Bio, Psycho, Social, Psychiatric Nursing Assessment. Complete the entire assessment with an individual in your care diagnosed with a psychiatric illness. Format your assessment in the order and format located on page 126 with these exceptions. Do not use the individual's name. First and last initials are to be used only. And do not sign this document prior to uploading. Just simply type your name and title at the bottom of the document prior to uploading. And then you will upload, right, by attaching your file. Let's take a look at the rubric. This assignment is worth a whopping 50 points. And this rubric is going to look a lot different than your other rubrics because this corresponds with page 126 in your textbook, box 10.1. And basically, each of these items from that box are worth a certain number of points. Now, you will see that certain elements are worth more points. Other elements are worth fewer points. So again, use this rubric to help guide how much time and attention you pay to each of of the requirements for this assignment. Okay, and then quiz 3, remember, same rules apply for this quiz as all of the other quizzes. It's unlimited as far as the time. You can use your textbook and any supplementary material that you would like. All the questions are asked at once, but you can only take it once. So please do not click this button that says begin until you are ready to begin the quiz. And again, with any general course questions, please go to the discussion board, click on this first forum, create your thread, ask the question, and then either I or one of your peers will get back to you in a pretty short order. Okay, this concludes the tutorial for Module 3. I hope you find it helpful. And remember, after this week, you will be at 50% completion for the course. So keep your eye on the prize. Keep up the good work.